Mind over matter is a phrase that has been used in several contexts, such as mind-centric spiritual doctrines, parapsychology, and philosophy. Merriam-Webster Dictionary defines mind as the element or complex of elements in an individual that feels, perceives, thinks, wills, and especially reasons, and mind over matter as able to a situation in which someone is able to control a physical condition, problem, etc., by using the mind. Origin. The phrase mind over matter first appeared in 1863 in the Geological Evidence of the Antiquity of Man by Sir Charles Lyell 1797–1875, and was first used to refer to the increasing status and evolutionary growth of the minds of animals and man throughout Earth history. It may be said that, so far from having a materialistic tendency, the supposed introduction into the Earth that successive geological period of life, sensation, instinct, the intelligence of the higher mammalia bordering on reason, and lastly, the improvable reason of man himself present us with a picture of the ever-increasing dominion of mind over matter, by Charles Lyell, 1963. The power of mind over matter. Heal thyself, think positive. Everything's going to be fine. Go on, try to convince yourself, because realism can be bad for your health. Optimists recover better from medical procedures such as coronary bypass surgery, have healthier immune systems, and live longer, both in general and when suffering from conditions such as cancer, heart disease, and kidney failure. Annals of Behavioral Medicine. It is well accepted that negative thoughts and anxiety can make us ill. Stress, the belief that we are at risk, triggers physiological pathways such as the fight or flight response, mediated by the sympathetic nervous system. Heal thyself, trust people. Being lonely increases the risk of everything from heart attacks to dementia, whereas a good social life means better sleep and slower aging. Your attitude towards other people can have a big effect on your health. Being lonely increases the risk of everything from heart attack to dementia, depression, and ill health, whereas people who are satisfied with their social lives sleep better, age more slowly, and respond better to vaccines. The effect is so strong that curing loneliness is as good for your health as giving up smoking. In January 2011, Cachopo reported that in lonely people, genes involved in cortisol signaling and the inflammatory response were upregulated, and that immune cells important in fighting bacteria were more active too. He suggests that our bodies may have evolved so that in situations of perceived social isolation, they trigger branches of the immune system involved in wound healing and bacterial infection. An isolated person would be at greater risk of physical trauma, whereas being in a group might favor the immune responses necessary for fighting viruses, which spread easily between people in close contact. Crucially, these differences relate most strongly to how lonely people believe themselves to be, rather than to the actual size of their social network. That also makes sense from an evolutionary point of view, says Cachopo, because being among hostile strangers can be just as dangerous as being alone. So in the end, loneliness is not about spending more time with people. Cachopo thinks it is all about our attitude to others. Lonely people become overly sensitive to social threats and come to see others as potentially dangerous. In a review of previous studies, published last year, he found that tackling this attitude reduced loneliness more effectively than giving people more opportunities for interaction, or teaching social skills. If you feel satisfied with your social life, whether you have one or two close friends or quite a few, there is nothing to worry about. But if you're sitting there feeling threatened by others and as if you're alone in the world, that's probably a reason to take steps. Heal thyself, meditate. Monks have been meditating on mountaintops for millennia, hoping to gain spiritual enlightenment. Their efforts have probably enhanced their physical health too. There is some evidence that meditation boosts the immune response in vaccine recipients and people with cancer, protects against a relapse in major depression, soothes skin conditions, and even slows the progression of HIV. Meditation might even slow the aging process. Telomeres, the protective caps on the ends of chromosomes, get shorter every time a cell divides and so play a role in aging. People who meditate have lower cortisol levels, and one study showed they have changes in their amygdala, a brain area involved in fear and the response to threat. Meditation may also boost pathways of restoration and health enhancement, perhaps by triggering a release of growth and sex hormones. Heal thyself, self-hypnosis. Hypnotherapy has struggled for scientific acceptance ever since Franz Mesmer claimed in the 18th century that he could cure all manner of ills with what he termed animal magnetism. Part of the problem is that it isn't clear exactly how hypnosis works. What clear is that when hypnotized, people can influence parts of their body in novel ways. It has shown that under hypnosis, some IBS patients can reduce the contractions of their bowel, something not normally under conscious control. Their bowel lining also becomes less sensitive to pain. Hypnosis probably taps into physiological pathways similar to those involved in the placebo effect, says Irving Kirsch of the University of Hull, UK. Most clinical trials involving hypnosis are small, largely because of a lack of funding, but they suggest that hypnosis may help pain management, anxiety, depression, sleep disorder, obesity, asthma and skin conditions such as psoriasis and warts. Finding a good hypnotherapist can be tricky as the profession is not regulated, but hypnotizing yourself seems to work just as well. Self-hypnosis is the most important part. Heal thyself, know your purpose. In a study of 50 people with advanced lung cancer, those judged by their doctors to have high spiritual faith, responded better to chemotherapy and survived longer. Over 40% were still alive after 3 years, compared with less than 10% of those judged to have little faith. Are your hackles rising? Of all the research into the healing potential of thoughts and beliefs, studies into the effects of religion are the most controversial. There are thousands of studies purporting to show a link between some aspect of religion, such as attending church or praying for better health. Religion has been associated with lower rates of cardiovascular disease, stroke, blood pressure and metabolic disorder, better immune functioning, improved outcomes for infections such as HIV and meningitis, and lower risk of developing cancer. For instance, religious people often have lower risk lifestyle and churchgoers tend to enjoy strong social support, and seriously ill people are less likely to attend church. Nonetheless, a recent analysis of studies in the area concluded, after trying to control for these factors, that religious, spiritually does have a protective effect, though only in healthy people. Even if the link between religion and better health is genuine, there is no need to invoke divine intervention to explain it. Some researchers attribute it to the placebo effect, trusting that some deity or other will heal you may be just as effective as belief in a drug or doctor. Believe that the positive emotions associated with spirituality promote beneficial physiological responses. Yet others think that what really matters is having a sense of purpose in life, whatever it might be. Having an idea of why you are here and what is important increases our sense of control over events, rendering them less stressful.